Hello, and welcome to Wellness Wednesday with 3W. Wellness Wednesday is sponsored by 3W Medical for Women, a nonprofit medical clinic offering free of charge or low-cost reproductive health services to women in the Seattle area, regardless of income or insurance status. 3W does not profit off of the reproductive health choices women make. The information shared in this podcast is the opinion of the speaker or speakers. Medical information is not intended as individual medical consultation, but for general education only. Always consult your own health professional for personalized advice regarding medical decisions. And if you're in the Seattle area, consider making an appointment to consult with us. I'm Helen Nguyen, CEO and co-founder of 3W Medical for Women and the host of today's podcast. Hi there, Wellness Wednesday listeners. I am back in the studio. Feel like I'm a bit rusty because it's been a hot second, but thank you for hanging in there and continuing to listen to our podcast, which I love to do. Today, I have a guest speaker with us. It's Dr. Sarah Pederson from Vera Fertility Clinic out in Colorado. And I've met her personally in person through a bunch of different these health conferences that we go to, but I've been watching her clinic from afar. And so I was like, Dr. Pederson, we got to get you on our podcast to talk about this because I want to say on a weekly basis, I get some sort of girlfriend, relative that is saying, I'm dealing with fertility issues. What can I do? And so here we have Dr. Pederson on our Zoom studio today. And can you tell us a little bit about yourself?
Yes, thank you so much for having me.
Yes.
My name is Vera Pederson. I am an OBGYN and I specialize in holistic fertility and women's health. And our whole goal is to help patients map their hormones, learn about their nutrition, their digestion in a way that enables them to empower them to be able to live so that they feel amazing every day, optimize their fertility, and have the families that they want as naturally as possible. So we really have that perfect blend between Western medicine and holistic medicine so we can give the best of both worlds because not everyone's in the textbook. Sometimes you have to think outside the box and really personalize the care to each person.
That's exactly what women's health needs these days. There's not this cookie cutter, if you have A, go to B kind of approach because we're all unique individuals.
The most obvious thing is we think about our pregnancy, right? No two pregnancies are the same. No two postpartum journeys are the same. No two hormone journeys are the same. So that has to be a specific plan individualized to you because it's not going to look like anyone else's.
How did you get into this? Because you could have gone a gazillion different routes, right?
I've always been drawn to women's health. When I was younger, I had a humongous ovarian cyst. I'd have this huge surgery, take out my ovary, all these things. And of course, when you're in that stage, you're thinking, oh my gosh, how's this going to affect my fertility? But I had a wonderful OBGYN who started mentoring me in a way that led me onto this pathway. And unfortunately, when you're in medical school and residency, you learn a lot of medicine and a lot of surgery, but you don't learn a lot about nutrition, exercise science, and true hormone balance. So I really just wanted more, hungered for more. And then I started this whole journey about learning about holistic and integrative medicine. And the best part is that you never stop learning. Right now, I'm taking this whole course on gut health because we do a lot of gut health testing for our patients. And I really want to make sure that I can offer the best possible advice because there's such a huge relationship between your gut, your hormones, your thyroid. So this is the best part is that you never stop learning. There's all these amazing things coming out in women's health, all this beautiful technology. And then once you learn different techniques, how to make people feel amazing every single day and empower them, where they know how much protein to eat for breakfast, what their grocery list should look like, how much do they need to run or not run or work out, how much sleep do they need so that they ovulate, they have amazing luteal phases, they have no PMS symptoms, they have pain-free periods. Once you do that, you never go back. Like holistic medicine is the best.
I wish I had access to you guys when I was in my teens and 20s and having debilitating periods and cramps and not knowing where to go or getting very dismissed, right, from other physicians that were like, just go on contraception or that's just That's just life as a woman, right? And that was what I was told over and over for decades. And to know that you guys are occupying this space and saying, actually, let's peel back the onion, and there's so much more resources that honor how your body works instead of the quick fix Band-Aid approach, take this pill, good luck kind of approach. So thank you for doing what you guys do. You take patients from Washington State, right?
Telemedicine. Yeah, we do a lot of telemedicine.
That's where medicine is going.
We can do it we do a lot of expert medical consulting.
Yes.
And I think to your point, when you were saying you have pain, sometimes you just have to look at a lot of different things. And not, for example, pain has a lot to do with your uterus health, your vaginal health, but also your gut, other sources of inflammation, autoimmune issues, allergies are a huge source of inflammation. So taking the entire body into account is so important. I had a patient who had been seeing all these doctors. She couldn't get pregnant. Everything was coming back normal on her labs, but she had horrible seasonal allergies. And I said, no wonder you're having painful because your body is just constantly in a state of fighting, right? If you're constantly inflamed, you're not going to be able to make hormones properly. You're going to have pain during your periods. And she said, oh my gosh, you think my allergies have anything to do with my health? I said, of course they do. And she said, no one ever told me that.
Yeah.
She took allergy. I had her take all these allergy medications, really get them under control. And she was pregnant in 2 months.
That's crazy.
We didn't have to do anything else as far as we didn't give her any medication, all of that. We just had to pay attention to the other symptoms of her body.
It's like our bodies are trying to tell us something all the time, huh?
100%. I love you. I tell my patients that all the time. Listen to your body. It will tell you what it needs.
Oh, I'm so grateful that you've stepped into that world because we need more folks like you saying what you're saying. I'm using this word loosely of just copping out and saying, you have infertility, it's unexplained infertility, you have just really bad PMS, that's it. Because that's just not enough when our bodies are trying to constantly tell us something. And just honoring that communication and saying, why not listen? This new thing that I saw on your newsletters and emails that I've been getting, intrauterine PRP wash service. What is that?
So we actually stole the technology from other areas. If you've ever heard of a vampire facial, they actually so what PRP is, it stands for platelet-rich plasma.
Okay.
So we take your blood, we draw your blood, and then we spin it down to just the platelets because platelets are healing cells. That's what goes to an area of your body that's damaged that needs healing. So when you get cut, all your platelets come and heal. So, for example, in dermatology, they'll do vampire facials where they'll put PRP in your skin in order to rejuvenate your cells. They also use it in orthopedics. A lot of times people will get PRP injections in their joints to try to heal the joints in order to prevent them from having to have surgery and things like that. Okay. So we've extrapolated some of that, and now I use PRP in the uterus, and it's really helped rejuvenate the uteruses of our patients. Like I just did 2 of them this morning, for example. It's really helpful for patients who've had recurrent miscarriages, who have scar tissue or Asherman's. Sometimes that can happen if you've ever had a procedure, a DNC, an IUD, misplaced IUD.
How about a LEEP?
A LEEP is a little bit different because that's on your cervix.
I see. Okay.
This is actually in your uterus lining. And then it's very helpful. I just had a patient who had a misplaced IUD and it really scarred her uterus. She hadn't had a period in 9 years. She came to me and she said, okay, what are all the things that we can do? And I did PRP wash in her uterus and she had her very first period in a month. And she called me and she said, Dr. Pederson, I've never been so excited to have a period in my whole life. So it can be very rejuvenating and healing for your uterus. And for people who have chronic uterine infections, things like that, it helps the uterus lining grow back thick and healthy in a way that enables you to have healthy, regular periods again.
You're totally blowing my mind. Okay, questions. This is not like period blood, right? This is just normal blood.
We draw the blood from your arm. We draw the blood from your arm.
Oh, okay. And then you spin it down. And you use that. And so what does that look like when you're saying you did this procedure? What does that procedure look like?
I do it in the office and in the operating room. If you're in the office, you lay down like you're having a pap smear. We put a little catheter in your cervix and then we shoot your PRP through the catheter and just let it sit in your uterus.
Is it painful?
It feels really crampy.
Okay.
Super, super crampy.
So do you take any pain medication to like prep for it?
You have to take ibuprofen and that's it.
Wow. And how long does
If you're a patient who doesn't do well with procedures, then you can take oxycodone, Xanax, something for pain and anxiety, that kind of a thing. But
Okay.
otherwise, it's relatively straightforward.
Okay. And how long is the procedure?
It takes us, so you have to draw your blood and spin it down. So that's separate. We usually have you come into our office within the week because it's only good for a week. So you have a blood draw appointment. We draw your blood. Our medical assistant preps all the blood because you have to do a process to get the platelets out of the blood. And then we have this little vial of your own blood. And then you come, you get undressed. It's like having a pap smear and put a little catheter in, and that whole process only takes about 2 minutes. And then we have you lay there for 20 minutes, just flat, listen to music, listen to a podcast, and then you stand up and you go home.
There's
no restrictions.
Is there any discharge afterwards or anything?
Sometimes the PRP might flow out of your uterus. So when you stand up, you might have a little bit of watery discharge.
Okay. And you don't feel anything afterwards?
About 5 to 20% of people will have cramps for about a day.
But that's completely normal and expected.
95% of people, by the time they walk out of here, they feel completely fine and they have no issues.
And do you do this multiple times? Once? How?
It depends what's going on, and we watch the outcome. So, for example, if we're doing it because you have chronic metritis or a chronic infection of your uterus, you want to biopsy your uterus afterward to make sure it's working.
I see.
Because if you still have a chronic infection, then you have to do it multiple times. Or, for example, people who have a really thin uterine lining, sometimes they'll need it multiple times to help get their uterine lining thicker and thicker, because there's certain goals that we want to shoot for on ultrasound to make sure your uterus lining is thick enough to support a healthy implantation. We also do it in the operating room. So, for example, I just did it this morning on 2 gals who were already having hysteroscopies. So one of them had recurrent miscarriages, and then one of them had recurrent infection. And so I was able to shave down their uterus lining. I describe it like a uterine haircut. Give the uterus a little haircut.
I love that.
And then you put the PRP in.
This is like blowing my mind. I've never heard about this before. This is so cool. So does this help with anyone that has PCOS or endometriosis?
Endometriosis is different because endometriosis is inflammatory cells on the outside of your uterus.
I see. Okay.
This is the inside of your uterus.
This is their inside. Okay. So who would be an ideal candidate for this type of service?
People who've had 1 or multiple miscarriages.
Okay.
People who have a thin uterus lining. Okay. And then people who have chronic endometritis or chronic infection in their uterus. So if you've been trying to conceive or you've had miscarriages or something isn't making sense, I highly recommend doing an endometrial biopsy to test for inflammation and infection, because it's something that we see all the time that is so commonly missed. And the uterus infection is just really hard to treat because it requires different antibiotics, sometimes multiple rounds of antibiotics. It's like having a UTI, but in your uterus.
Why is it commonly missed or misdiagnosed?
Because people just don't check for it. And there's not a ton of obvious symptoms. The symptoms can be really subtle. For example, having an odor during your period, having black or brown bleeding either before or prolonged after your period. Having pain on your period. Some of those things we just normalize, right?
Yes.
Oh, I just have this smell, or, oh, you're supposed to have pain on your period, or, oh, I don't know anybody else's blood. I don't see anybody else's blood. Like, I thought that black was normal.
So are you guys the only one that's doing this, or are there other people that are doing this that you know of?
So everybody else that does it that I know of is an IVF clinic. So they're using it to prep people's uteruses for IVF. So we're the only clinic that does it for just your own natural fertility.
And how many people have reached out to you since you started doing this to go, I want to get my uterus washed with my own blood?
I know, it sounds crazy. I
No,
want
it
to hear
sounds like awesome, actually. I want to do that.
facial, rejuvenate your uterus, get it all ready to go.
Yeah. Yeah. Because, like, I've just never heard of it. And you would think in the Pacific Northwest, since we're so much more open to the more natural approach to things, that we've heard about it enough out here. But you guys are the first ones that have introduced this to me.
But I think that's the beauty of holistic medicine and women's health and just medicine in general is that there's always amazing things that we can be adding,
Mm.
that we can be offering our patients, research that we can be doing. And sometimes
Yeah.
you just think really creatively. The original use of PRP is actually intra-ovarian to put it in like in women's health. Of course,
Yeah.
we talked about dermatology and ortho, but the original use was because and I do this too, inject it in ovaries in order to help people's egg quality. So we do intra-ovarian and uterine washings of PRP. It works really well.
So, what's the average? How many times? What's depending on your needs, obviously, but can it be one and done, or is it
Oh
upwards of
yeah,
5?
the vast majority of people only have to do it one time, like 95% of people. It's really rare that you have to do it multiple times.
That's so cool. When are you gonna come out here
Yeah.
and do this for us?
It's
It's
I selfishly, it's really fun, and luckily, it's not that painful. It's
yes.
relatively straightforward.
Yeah. I think if you can survive a PAP, this sounds
Right.
something very
It's kinda like
similar.
advanced pap smearing.
So how is this different? My sister brought this up for me. How is this different from this new thing she was like, they use, like, burning to wash versus blood. Do you know anything about that? I don't know the actual medical terms to it.
Like an ablation?
Yeah.
But an ablation you do for somebody where you don't wanna have kids anymore.
Ah,
There
okay.
is something called a uterus ablation.
Mhm.
That is where you burn the lining of your uterus
Yeah.
and to try to get you to have no period at all because your period's driving you crazy.
Okay, no, we don't want that.
And sometimes, for example, if you're perimenopausal or
Yeah.
menopausal and you're having these horrible bleeds and you're done having kids
Yeah.
and you don't want to have a major surgery,
Yes.
that can be really helpful
Okay.
because then we can burn it sounds really aggressive, but we can burn your uterus lining
I know.
so that it doesn't give you these crazy horrible periods and you can sail into menopause happily. But this
Okay.
PRP is kind of the opposite. We're trying to rejuvenate your
Right,
life
yeah.
back and
My
help.
sister, with my history of having really difficult periods, she was like, "Maybe you should explore this burning thing."
Mhm.
And I was like, "Wait, let me explore this washing thing first before I burn."
Yeah, do not get your uterus burned.
Yes, absolutely. So, do you know anyone out here in the Pacific Northwest that's doing what you're doing?
No.
Okay.
But you have to realize it's very novel.
Okay.
It's very experimental. It's very
Yes.
new. It's definitely not the standard of care at all. That's why people come to me is because
Yeah.
I'm willing to think outside the box a little bit and
Yeah.
do things that are not always what
Conventional.
everybody else. Right, exactly.
Yeah, I'm telling you, with my issues with infertility for as long as I've had and heavy bleeding and I'm part of all these like social media groups, right? And constantly trying to peel back the onions of like why this is happening. But more and more, because I've been so candid with my story on podcast and all of this stuff, I want to say every week I'm being reached out to by someone, either an acquaintance or a friend or a relative that's like, I've hit my wall. I've hit my max out here on what to do. And again, thank you for what you guys are doing. I'm wondering how we can bring this out here to do.
We can teach you, send somebody out, I'll teach you.
Oh, okay. I might
I
take
mean,
you
if
up.
you can draw blood, if you can already do procedures,
Yeah.
you can do it.
Yeah, but it's beautiful that there's an alternative approach, right, to all of this. And just thank you so much for pioneering, for introducing this to me and for introducing this to the world.
It's like you definitely have to learn, right? Like I had to
Mhm.
learn the protocols and do all the research and go to other clinics and have them teach me, but it's totally worth it.
And then is there a long wait list right now for you guys? Or are you guys
No, I
accepting
mean,
patients all the time?
those types of procedures we try to do between your period and ovulation, because if you're going to have something inside your uterus, you can't be pregnant. So you can't have sex between the time of your period and the procedure. So we try to time it cycle days 3 to 10
Okay.
so that you can still try that cycle if you're trying to conceive. And there are people who do PRP for other reasons to try to help with their uterus, but if you're trying to conceive, so we get you in within a week because it's time sensitive.
Yes, totally. Okay, just to piggyback on what you just said. So for those that are trying to conceive, this is a tool, this is a resource. What other issues could be addressed?
Vaginal and uterine pain is a big one. Cramping is like a whole world of things
Okay.
that I recommend a big workup for.
Yeah. Yeah.
Because there's tons of different reasons for pain and cramping, but an unhealthy uterus lining can be one of those things that we can definitely help rejuvenate.
And before you know you have an unhealthy uterus lining, what are labs or ultrasounds or MRIs that you need to do before you determine that?
You definitely wanna have an ultrasound to see how thick your uterus lining is,
Okay.
and then an endometrial biopsy to check if you have any inflammation or infection and the health of your cells.
Okay. And do you guys handle that? Or for a patient that's out of state, would you
We
recommend
do
that
it here.
you guys do it there?
Yeah, we do it here, or for out-of-state patients, we'll order it to an imaging center where you are.
Okay.
But biopsies, you gotta come here.
You only trust yourself to handle it.
Well, I mean, there is a little bit of that, is that usually when you do an endometrial biopsy, your OBGYN will only send it for pathology.
Okay.
So a lot of times if you're getting a biopsy locally, I'll write a letter to your OBGYN and ask them to send it for culture and special stains. So for example, the stain for endometritis and inflammation or infection in your uterus is called a CD138 stain. We have the pathologist look for the presence of white blood cells, or sometimes they're called polys, to see if there's any evidence of infection or inflammation, because there's a lot to a pathology specimen other than just what the cells look like and that they came from the endometrium. We want to know what the health of those cells are.
So it's a very specific thing that you're looking at.
And hopefully it'll become more mainstream. Like every woman, this should always be a part of an endometrial biopsy.
Amen.
But we're getting there. Trying to
Okay.
change the culture for sure.
Does it help with anything pertaining to cyst or fibroids?
Because ovarian cysts, those are on your ovaries, so that's outside your uterus. And then fibroids, they're in the walls or on the inside of your uterus. But from just a medical and fertility perspective, oftentimes you want to have your fibroids removed, especially if they're on the inside of your uterus. However, for things like, for example, when I do endometriosis surgery, now I do PRP in all of my endometriosis surgeries. So if I take out endometriosis on the outside of your uterus or on your ovaries, then I'll inject PRP to make sure that it doesn't scar.
Wow. And that
You know, those are
helps.
oh yeah, it's huge. Those are the 3 big applications: is uterus washes, endometriosis surgery, and then egg quality or ovarian health.
Dr. Pederson, you have blown my mind today. It's so cool. I always thought you were cool, but this just put you on another level of coolness.
Oh, thanks, Helen. Kids, so they think I'm cool.
I just find it like this is such an amazing tool.
I have people fly in from all over the country just because it's not always available.
I'll definitely bring this up to my medical staff. See if knowing them, they'd probably be like, let's do it next week.
Or if you want to be trained, like we're very happy to pay it forward.
I think a lot of our patients who are looking for a much more holistic approach, more out of the box thinking, more out of like conventional medicine would be like, I'm down to do this. And what better place to do it than Seattle, right? Where we're all granolas out here. Thank you so much for enlightening me about this new cool service that you guys are doing. I'm so grateful that you guys take patients from all over and make it so accessible to us. You guys just are rocking it. I just thank you so much what you guys do.
Thank you.
Well, you heard it yourself from Dr. Pederson. She's taking patients all over right now. If you want to get an intrauterine wash or just a consult about if you're the right candidate for it, please reach out to Vera Fertility. They are wonderful, and they're all about optimizing your body to the fullest extent. Thank you so much for your time. We will list all your information, like your website and all of that stuff on our podcast. And so look out for more patients from Washington State. Thank you so much, Sarah. Thank you so much for your time. For more information about 3W, please visit our website at 3wmedical.org. That's the number 3, the letter W, medical.org. From there, you can learn more information about the services we provide, book an appointment, or make a donation if you'd like to support our mission. You can also call our office at 206-588-0311. That's 206-588-0311. If you like this episode, please share it with others and consider subscribing on your favorite podcast platform so you never miss an episode. Thank you so much for listening, and until next time, stay healthy and be well.